My name is Wendy. I am originally from Oklahoma, but lived everywhere and I travel a lot. How I came to find Envita is a very good question.
The first time I met Wendy, she was sitting across the desk from me, and she was with her sister Donna, and she was out of it. The two things I noticed right off the bat were brain fog and severe amount of pain.
Lyme disease I was diagnosed with in August of 2011. I was hospitalized. I had many symptoms for years prior to that, but it finally put me in bed and in the hospital. I always said that I never had any problems in my entire life until I turned 30 and started having babies. So that was about the first time that I was probably bitten and exposed. Did not know it.
I could relate a lot of her symptoms to what I see with the patients that are currently coming in, and I knew that again with the testing and what we were going to be able to find would be significant to be able to allow for there being a good therapeutic treatment option for her.
I would all of a sudden forget where I was traveling. I had to use GPS to find my own house. After a while, a lot of the symptoms I had, I kept to myself because I was afraid what would happen in my job. I had payroll, I had employees, I had things that I had to take care of. I had a young daughter.
Yeah, she was going and receiving vitamin therapies and nutrient therapies, ozone therapies, and she didn't get a response.
I found a doctor that did nutritional IV therapies, got a port put in 3 years ago now. So I'd been receiving these, but my health just continued to decline, and especially my brain function. How I actually found Envita, I don't know. My family said I did the research.
She never remembered my first appointment with her. She had never remembered the full 4 weeks of therapy that she received before she actually started to be able to come to it and had a realization of the time, the date, the year.
I don't remember coming out here. I don't remember my initial treatment. It took about 12 to 15 brain treatments, and then I woke up.
When she started to be able to receive that therapy, her brain fog started lifting. We started to be able to get a good response in regards to her pain management, to be able to actually wean her off of her pain medications, to be able to actually bring about some good response to get her pain under control.
When I started here, I couldn't speak a full conversation. I would have a hard time getting out one sentence that actually made sense. So my speech pattern was greatly affected. And then after, I was here for 10 weeks before, about the 9th week, the other patients started noticing, wow, you can talk and carry on a conversation. And that's when my light bulb went off that I was actually getting better.
She had actually gone home one of those times after treatment, and she received a very similar bag with what would be the same constituents as she received here. But when she went home, she wasn't getting an effect.
I came back to Envita the second time so I could get real medicine by people who really care. I was paying a lot of money for maybe a quarter of the dose of the medicine that I was getting at home. The first time we noticed my brain function came back, we were so excited, thought I could go home and continue. We didn't realize how diseased my GI tract was and my endocrine system. So when I came back, that is what we have focused on, and 14 weeks later, I'm excited and ecstatic to go home and help other people that I know have Lyme disease.
It was emotional for us because I came to the realization that, we had just changed this woman's life. We had gotten her life back, literally from a comatose state to actually living her life again.
Envita saved my life.
Tears are coming to her eyes, tears are coming to my eyes, and we're coming to a realization of that her life is finally, she's got her life back.
It's the whole dynamic that Envita has. It's not just your patient care coordinator, it's not just the doctor, it's not just the nurses in the back, it's everything together. The way that they have the rooms set up, it's the camaraderie between the patients. They nurture every single part of your wellness.
There is possibilities. If you find the right diagnostics and you find the right treatment approach, we have a lot of tools to be able to go after it. Hope exists.